Hello, my name is Jacob. I'm a student physical therapist assistant with CBD College, and today we're going to be going over the case of our 43-year-old patient who was a dentist who ruptured their left Achilles tendon during a tennis match, and they are currently 2 weeks post-op. We're going to go over some interventions, such as the sequence of exercises and how we're going to progress them, some precautions that we need to look forward to, and some additional interventions that we're also going to add to the program. So going off, we're going to start from the acute phase. This will be weeks 2 through 4. And from there, we're going to have them start off with some range of motion exercises. First one can be seated towel stretch. We're going to get a towel, and I'm going to have them pull that towel, so toes towards shin. Hold this for 30 seconds. Let's say 30 seconds goes by, and we'll have them do that 2 to 3 times so they can really get into that stretch in that dorsiflex position. Our next one is going to be, I'll have them do an active, gentle plantar and dorsiflexion in a seated position, just so that they could still have some movement and muscle activation as well. And I'll just have them do this 2 to 3 times, about 10 repetitions each. And then next one is going to be seated heel raises. So with this exercise, it slowly reintroduces loading without full weight bearing, and you could add a small weight per your tolerance. And so some ways that we would want to progress this or see progression in the patient is if they're showing that they have improved range of motion, reduced pain levels, and they can tolerate some weight bearing. Next is going to be our subacute phase, which is going to be weeks 4 through 8, and this will mainly be focusing on strengthening the exercises. So another one would be, let's assume that this is a band. I would have them do banded ankle pumps so that we go into plantar flexion, and I'll have them do this around 3 times, and then up to 3 sets up to 10 times. Next, we would also introduce some standing heel raises, and you could add minimal weight based on your weight per tolerance. So from there, we would do progressions going based off of, again, reduced pain, no inflammation or anything like that. And then going forth, we would reassess their gait, see if they're able to properly weight bear enough. Going based on that, if they're able to meet those criteria, then we can move them on to the chronic phase. And the chronic phase is going to be around 8 to 12 weeks post-op. And so we would have them performing more functional exercises, such as walking on the treadmill. And then as we're walking on the treadmill, I don't have one right now, we would slowly and gradually increase the incline to add stress on the Achilles tendon. And again, we're going based off the individual's tolerance and really testing to see can they handle that gradual incline. And then as well as some balance and proprioception. So some single leg activities, as well as, let's assume I had an Eric's pad that would simulate an uneven surface. I would have them just weight shift back and forth, like so. Some ways that we would see how we could progress them further, some of the criteria would be that they have functional mobility, right? They could go upstairs, uneven surfaces, again, gait reassessment, seeing that they can walk without compensating for certain aspects of the injury, and obviously tolerating weight bearing. So can they put their own weight onto that ankle for that injured Achilles tendon? And then some precautions that we want to avoid as well are overloading the individuals. So we don't want to really re-injure or re-strain that still healing tendon. So no overloading. Next, another precaution would also be following the orthosis instruction. So making sure that you follow the MD's protocol just to ensure that you don't re-injure it and you don't prematurely remove it during exercises or anything like that. And there was one more thing I'm trying to remember. Oh, monitoring for any complications. So let's see, checking to see if there's infection at the surgical site, as well as is there re-inflammation, is there swelling again, is the pain level increasing in the individual. So monitoring aspects like that. And then some additional interventions would be adding sport-specific drills. So testing their agility training. So like I said before, lateral shuffling, quick change in direction. I don't want to injure mine, but also introducing plyometric exercises. So introducing jump squat. Also, other interventions are going to be some functional interventions. So gradually reintroducing the individual back to running. So we would start at walking, then to a slow jog, and then progress that jog into a sprint, hopefully. Because we also want to introduce court-specific drills too, such as, like I said before, lateral shuffling and the short sprints, short bursts and sprinting. Just because that applies to the individual's sport. And then moving on, we would also do functional gait assessment as well. So we would have the PT reevaluate the individual's walking ability, see do they follow the proper gait pattern, and going back to the chronic phase, this would also be part of the criteria too, where that the individual is able to perform functional activities in their daily life. And then lastly, another intervention would be core strengthening, so that we can really solidify that structure of support for balance, just so that when the individual is upright, they can activate their core, and all the weight doesn't necessarily need to be placed on the Achilles heel or the Achilles tendon. We have that support from our core to keep us upright and balanced. Thank you.